Hi, Caroline. How are you today?
Fabulous, Rob. Thanks for asking.
Yeah, no, I'm really excited for our guest today. At a time when we're talking about chronic disease in the workplace, one subject that continuously gets underlooked by benefit plans, to say the least, is obesity in the workplace. And at a time when we're talking 2 out of 5 Canadians are recognized as being obese, I think there's such an opportunity and timing for our guest today.
Yeah, definitely. I am really excited for our guest because I think we're going to learn about what is obesity and what it means as a chronic disease. I think there's so much being thrown out at us out there, whether it's commercials on TV or otherwise, that here's a drug, here's a fix, lose weight, and it's easy now. But there is a cost to that. There's a high cost, and there's also a lot of stigma and facts that are just not well known. So we're going to learn a lot. We're going to learn how to build an inclusive plan that builds awareness about what is obesity. And I think at the end of the day, helping an employer communicate that to plan members to access not just via drugs, but other methods to really support plan members and their families. So let's bring in our guests.
Looking forward to it.
Well, as we get things started, I'd like to welcome our guests here, Sandra, Elia, and Neda Nasseri. Sandra, tell us a little bit about yourself.
Thank you for having me here. I am the chair of Obesity Matters, which is a nonprofit organization that educates, advocates, and empowers people living with obesity. I also have my own lived experience with obesity.
Hey, good. Well, welcome. And I know this will be an excellent conversation. Neda, tell us a bit about yourself and where you're from.
Yes, thank you for having me as well. So I'm Neda. I'm a pharmacist by training. I've been with Desjardins Insurance now in a product director role for drugs and health. It's been 5 years now, very happy. And my involvement with obesity is actually partly with Obesity Matters as well. I'm on their advisory committee and very, very proud to be there. In terms of Desjardins, I've been working closely with the rest of my team on our it's called Healthy Weight Focus. So it's a type of positioning on obesity. So we've been working on that, and it's had a lot of traction. So we're very happy about that.
Well, welcome to you both. And to kick things off, Sandra, why don't you tell us? I think everyone has their ideas of what they think about obesity is and living with obesity. If you could help us right off the bat, dispel some myths and talk to us about obesity, what it is, and what we should be aware of.
Yes, great question. So I think I'm going to start by saying what obesity is not. So we often think of BMI, which is a very simple calculation of height and weight that tells us very little about a person's health and whether they have obesity. So obesity is when we have elevated weight, when we have adipose tissue that causes comorbidities, so that affects our health in some way. And it's important where we carry the adipose tissue, otherwise known as fat. If you carry that on your hips, your butt, your thighs, well, God bless you, you're just a different body type, and we all need to get over ourselves. There's not one kind of body type that is desirable or denotes health. Now, when you have somebody who could be of a very similar weight, however, that fat is carried over your vital organs, then we would consider that to be obesity, because that can lead to things like diabetes, especially if you carry visceral fat around your waist. It could lead to MASH. It could lead to hypertension, cardiovascular disease. This is when we become concerned. And another portion to understand is people living with obesity. I consider them to be a very vulnerable population. It is a population of people who have faced blame, shame, and discrimination. And so, yes, we're going to hear lots of obesity statistics likely today because that's what we go to, but it's very important to remember that behind every statistic is a real person like myself that have lived with the physical, emotional, and mental challenges that come along with this disease for some patients.
Yeah, I love that you said that, Sandra. Well said. And why is it so important for our listeners today to understand that obesity is a chronic disease and why that this shouldn't be ignored in 2025 as an employer?
So it is a chronic disease with many, many contributing factors, many of which are outside of a person's control. And it's incredibly important for employers to treat this because at the end of the day, every employer out there wants to thrive and be prosperous, and have a really healthy bottom line. You cannot do that without a workforce that is prosperous and thriving and healthy. You can't have one without the other. And it's not just about a great bottom line, it's about doing the right thing.
It's a dual return on investment for employers in both ways. You return on investment in the people you do, and as you said, like a healthier and happier workforce can lead to better ROIs for business. Yeah, good point. Good point. Ed, we'd love to chat with you a little bit about your involvement with Obesity Matters. So tell us about how you got involved with Obesity Matters and why it's important to Desjardins to be involved with such a great organization.
Yeah, it is a funny story actually. So, Obesity Matters was presenting to one of our colleagues in a completely other division. And for some reason, it ended up on my desk, and I ended up taking the meeting. So I was there. I was fascinated with the founder, who is Pretty Shala, who is a self-made woman. Honestly, she just leads this in an amazing way. Obviously, helped by Sandra and Rachel Atkins, as well as Rosemary Childerhose. And it's very, very important for me and for Desjardins as well to be part of the discussion because, first of all, obesity is like what depression was years ago, right? People tended to think it was just a lifestyle, that it was, you could just let it go and do a little bit of exercise and it would go away. And it wasn't considered a disease. Now, since 2020, I believe, the guidelines came out. America positioned themselves, Canada positioned themselves, the World Health Organization positioned it as well. It is a chronic disease. And like many chronic diseases, it requires chronic treatment. So that's why Desjardins is taking a stand in this posture because we think that it should be treated. Why would we treat any other chronic disease but this one? It just didn't make sense to us. So we put a lot of efforts, and we had colleagues that had very close experience as well with obesity and with sick parents with obesity. And so a lot of us were concerned, so we decided to work on that topic, and I think it's been successful.
And I would be remiss not to tell you that Obesity Matters was at the United Nations Assembly last week, and Priti Chawla and myself attended, and we were given an award. We were recognized for our leadership in tackling the global obesity crisis. It was quite an honor to stand beside ministers of health, secretaries of health, people from all over the globe, because obesity is reaching really a crisis level across the world. There's only two places left on this planet where obesity rates are not climbing at an alarming rate. So we do need to take action quickly.
Amazing. Congratulations.
Thank you.
So let's start off with something you said, Neda, that this is something that a lot of people do have a lot of stigma around, similar to mental health. And I want to ask Sandra directly, thank you for being so open and sharing what it's like to be someone that lives with obesity. Tell us about that. What is that like day to day?
Yeah, so I mean, I'd have to take you back into my 20s when I was living with severe obesity. And I worked for an international consulting firm, and I was there for 15 years. So they hired me at what might be considered a normal weight. And then I went through some very significant life stressors. And in about a year and a half, I gained 100 pounds. So I'm 5'2". That was extraordinary for me on many different levels. And I went to my employer and I asked for help. I asked for a reduced work week. Now, this was 25 years ago. I hope the HR practices are better today, but I fear that they are not. My HR person said, we can't do that because, Sandra, if we give you a reduced work week, everyone's going to want a reduced work week. And I go, really? Because my salary is going to be reduced. My bonus bill will be like everything that comes with a reduced work week. I don't think everybody wants that. And the answer was no, which then led me to go on to short-term disability leave. So I was gone for about 3 or 4 months. which was far more costly than if they had just answered my plea. And so I remember returning back to work really, really nervous, wondering how my career would be impacted. Would anybody believe that I needed time off because I had gained the weight? Clearly, that had been my, lack of self-will that brought that on. And my boss at the time, she put her hand on my arm and she said, "No, Sandra, we could see you getting sicker, sicker month after month." And as validating as that was, it was also really upsetting because why then was help not extended to me if you knew I was struggling? And what's really important about this story is that was at year 5. I went on to have 10 more years at that consulting firm because there's this belief that people in larger bodies don't don't work as hard, aren't as smart, don't have as much to contribute. And that is absolutely not true. I wouldn't have stayed there for a total of 15 years. Now, because this is a chronic relapsing disease, I lost weight, I gained weight, I relapsed, I was in a reprieve. I needed and continue to need support and treatment, likely for the rest of my life. And I don't say that to kind of worry somebody or have that feel like a burden, but we just need to know. No different than depression. If I was living with depression, that would be something that I would actively seek treatment for and monitor so that I can have a happy, fulfilling life.
It's amazing. Thank you for sharing your story first and foremost, right? I think that's eye-opening for a lot of people. And I'm sure there's a lot of people listening that can relate to your story too, Sandra. First, I'm surprised you lasted another 10 years at that organization that will remain nameless. And I think this kind of dovetails really well into our audience too, which are individuals that, manage benefit programs and are looking at ways more than ever to attract and retain their top talent. I think we've seen that coming out of, especially coming out of the pandemic, where right across Benefits Alliance and all our advisors, when we were just together at our semi-annual conferences a couple weeks ago in Montreal, and we talked a lot about strategies and options, and we spoke about obesity in the workplace. Neda, to come back to yourself, there's a lot of gaps when it comes to managing obesity and benefit plans. You brought up like depression earlier, that how things have changed, and today it's obesity is more kind of what depression was 15 years ago, where it wasn't recognized as an illness, a chronic illness for sure. So benefit plans are no different from that standpoint of where obesity medication's been really excluded from benefit plans, or now companies are looking at options. And maybe just in holistically to start before we get into that, talk about some strategies that your organization's been looking at from a drug plan management or even just overall benefit plan management when it comes to obesity in the workplace.
For sure. So I mentioned earlier that it's very important to treat this chronic disease in a holistic way. So that means covering evidence-based treatments. So that would be medication, that would be sport therapists. Very often, sport therapists are not covered in benefit plans for some reason. We've put it under physiotherapy. So, and we know a lot of people tend to opt into physiotherapy. So then people also have sport therapists. You've got nutrition counseling, and of course, you've got mental health support. Because when you look at the Canadian guidelines, the pillars that even are supposed to be used to prevent obesity as well. You've got psychology in there, and you've got nutrition, and you've got physical exercise, of course. So we have a partnership with Obesity Canada. We also partner with Obesity Matters, and we really want to make sure that all our service offers are compassionate. They're science-based, of course, and that they're aligned with clinical guidelines and patient needs. So what's cool is that there's currently 65% of our plan members that actually have access to obesity drugs. That's about 40% of our groups. And we also offer our plan members some rebates at virtual dietitian clinics. We have a partnership with Constant Health. Basically, it's these nutritionists that are trained in cognitive behavior therapy. So that's super helpful because it targets two of the pillars of obesity care. And we also have a partnership with Sword Health, a virtual physiotherapy clinic, to get people moving again. If they have knee pain, they can just get that knee fixed. And again, it's virtual, so they can do all of that in the comfort of their own home. And of course, the goal is to help the individual in its entire person.
And how would somebody access that? That's very unique, that friend in the marketplace. So is it do, maybe walk us through that process of a member's interested in either A, pursuing some of these options within their benefits program, or is it based on maybe a claim that gets submitted, that someone from Desjardins reaches out to that member to say, hey, you have these other options? Can you maybe walk our listeners through what's that process like?
Yes. So we wouldn't necessarily write to the individuals that are claiming a drug. At this time, we don't think, not everyone might perceive this as a positive experience for the plan member. So we'd rather give them the information and they are the ones who decide if they want to deal with a specific company or another one. That's, they can decide. And at the end of the day, when you look at it, it's all voluntary. And if someone has already had nutrition counseling in their life and already knows what to eat, why would we force them into going into another nutritionist to pay? And they're certainly going to have some little out of pocket, so why would we force that on them? It just doesn't make sense to us. So that's why we did not make any of this mandatory. I know some companies in the United States, they tend to make that mandatory in order to access the obesity drugs, but we don't. We ask the question to make sure that people are actually doing something in terms of targeting the pillars, but aside from that, it's not mandatory. So yeah, we really like the holistic approach, and I think it's pretty easy to access those as long as the plan sponsor has opted in, of course.
I like a few things that you said there, Neda, that there's pillars, and I'll even say it sounds like levers that people can pull depending on where you are, because it's got to be quite fluid, I can imagine, as to what, even if you had nutrition counseling at one point, you might need that kind of motivation or boost by interacting with a nutritionist. But rather than me perceive these things, maybe I'll ask Sandra, like, if you could dial back the clock or think about someone today, what type of resources or education or awareness should someone build to say, here's all of the different levels. What do you struggle with from time to time? What needs revisiting? Rather than trying to throw it all at you at once.
Well, I think without evidence-based treatment, people are kind of left prey to the diet industry. And that's really dangerous because we have research to show that people who go on, calorie very restrictive diets, crazy diets, if you will, or fads, that they lose weight in the beginning, but then they ultimately regain and end up heavier. So this is why it's quite dangerous. And it almost has the casino effect, right? Like the worst thing that could happen is you go to a casino and you play the slots and you win, because now they've got you hooked. And that's what the diet industry does. It always produces quick weight loss in the beginning, and over 95% of them will all fail and likely leave you heavier. So what I often tell people is this is the first time in history that we actually have a roadmap for treating obesity. And the three pillars, there's a psychological, behavioral pillar, there is a pharmacotherapy pillar, and finally bariatric surgery. So for some people, they will need to engage in all three. And that's totally fine and perfect, because we want people to get the treatment that they deserve. But if you're not engaging in at least one, you're not being treated for obesity. So this idea that I can just do intermittent fasting, or I can do keto, or I can do calorie counting, or fat, like we've had them all, that's not treatment. So this is an important thing for people to realize. So even when you go to your doctor, and often people that I work with will tell me, the doctor said I have to lose weight. Did they tell you how? No. Oh, okay. They just said eat less and move more. That's wholly unhelpful. And then I remind them that they need to go back to their doctor, maybe even provide some education and say, well, actually, these are the three pillars. So which one are you going to help me with? And maybe I need two or possibly all three.
And that's the unfortunate society that we're in right now. It's like the now generation, right, that exists. That I saw something on social media and I can do this and I'm going to lose weight. in 30 days. And it's a journey, right? It's not like just like take this pill and I'll be great in a week. I think it's critical that you said that, Sandra. I also think it's
And
great that your organization's out there, because unfortunately a lot of people's health practitioners, you go see your doctor, you're in and out in 15 minutes, and it's more than a 15-minute journey. So maybe, like, can you walk us through when people reach out to your organization for support, like what does that journey look like?
yeah, so the first thing you can do is sign up for our wellness workshop. It's free. It happens once a month. And I always worry that people aren't going to value it because it's free. But what we've done is taken the top obesity doctors and experts, and we put them on Zoom live to not only teach, but people then get a chance to ask questions of these top obesity doctors, get coached by them. And for me, that's sort of health equity, because if we work with Dr. Sean Wharton here in Toronto, somebody in northern Saskatchewan would never have the opportunity to hear from him and maybe even ask a few questions of him. So they can do that. We also are preparing a talk to your employer about getting benefits. So we're going to give people the language and discussion starters so that they can go to their HR departments and tell them why it's important for them to have this coverage. We also provide support meetings. Those are led by me. So that's where we build that community. And for the first time, many of our community members have arrived at a place where they feel that they are respected. There's no judgment. And we always roll out the red carpet for our community. And it's the first time they feel cared for and loved for in this really special way.
Very cool. And we'll make sure we put a link in our show notes for our listeners as well.
I was thinking the same thing, Rob. I'm like,
Ah,
there's
beat you to
that's going in
it.
the
Beat you
notes.
to it.
Amazing. I think that it sounds to me you've really built a great toolkit to help individuals find the words, find how to have that conversation with employers, which is amazing. Let's think. So, Rob, when you think about your clients, and a lot of that's who we're talking to today, the plan sponsors, the business owners that are looking at their benefits plan, and I feel like there is out there, I'm just going to say it, there's so many advertisements on TV or wherever you go that says, hey, here's the magic solution, take the drug. Yes, it's expensive, but it works. But there's always a catch, right? There's got to be, if you have to look at lifestyle, I have to think that there's going to be a detrimental effect of long-term use of drugs as being the only solution while changing nothing else. Like if you're not learning about exercise or learning about nutrition and habits, like maybe Neda, as a pharmacist and your background, you can talk to us about that, because I think that that is what is happening today. There's so many people that are just, there's my solution, don't have to worry about anything else, I take the drug, and it does happen and help for a while.
Yeah,
So
maybe I'll
tell us
jump in
about
real
that.
quick, and then Ned, I'd love to. Caroline said we'd love your opinion on this because you're right, and I'm that person that watches, like, if I'm watching TV and watching a sports game on the weekend, and there's like all these drug advertisements, and then of course for 30 of them, 20 of the 30 seconds, they're going on talking about all the possible side effects, right? And it's like you're gonna get giant eyeball disease, and you're gonna grow a second nose, and it doesn't matter the drugs, you're right, it's we get inundated, from an advertising and marketing standpoint, but Caroline's right, and I think the guidance is so important for anybody down any track. We're at a state where we have more information in our fingertips than any time in history. Yet there's probably more confusion and lack of knowledge of where to go and what's right, what's accurate, what can be trusted, and who can help me through this process. So yeah, so maybe to this, I'll pass that over to you after that.
Yeah, so who can help you? I would say your healthcare professional is the person to go to, right? As a pharmacist, I still do practice a little 4 hours a week, so I still see patients, and they have tons of question about those. Like in Canada, that type of marketing is actually prohibited. So you're not supposed to market directly to consumers. But, since we watch all this American television, we tend to see it anyway. And if someone would want to have access to all the side effects, they would need to refer to the product monograph, which will contain everything. Other than that, there's a lot of anecdotal things as well out there. So it's important to know your sources and to always look at the right place for the right information. So your healthcare professional is definitely there for you. As a physicians, obviously, are harder to get by, so it's easier to ask your local pharmacist.
And I do want to pick up on Caroline's point about any time you take medicine for a chronic illness, it is important to add in those lifestyle choices, I want to call them. Now, the way that we are starting to break down the stigma and the bias that people living with obesity face is the fact that everybody, whether you're 2 or 92, regardless of your weight, should be eating whole natural foods as best as you can, what is available to you. And whether you're 2 or 92, whatever weight, we all need to move our bodies. And so it's not about pointing a finger of blame at somebody who is living with obesity. You should be eating whole foods. You should be exercising. No, 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 no. Anybody who wants vitality and health needs to be doing these things regardless of your age or your weight. So that's an important distinction. And when we think about obesity, when you have a village of support around you, the more interventions, the more likely the success. So we have to look at how well are you sleeping? Do you have community support? Do you need to speak to a counselor for some of the things that may be driving you not to have the quality of life that you want? We can take obesity out of the center and we could put diabetes. We could take diabetes out and we could put anxiety disorder. We could take that out, we could put in depression. So that is true for everyone. And I think that's what will help to break down the discrimination, because there's an undertone that if you're living with obesity, clearly you're not doing those things, and clearly you're not disciplined, and clearly you're lazy. No, no, we all need to be doing them.
To jump on what you said, I just think that if more people were aware that 70% of obesity is actually from your brain, they might change their perception of the disease, because it's not, like you said, it's not about eat less and move more. It's about the brain. So that's why there's a huge pipeline of drugs coming out to target obesity in the next 10 years, because there's so many unknowns still as to how this works on our body.
Can you get into a little bit more detail for our listeners about that? When you say 70% of it's through the brain, what do you mean by that?
So it's caused by satiety issues, right? So when you look at that, I mean, partly that's something that we know already because there's tons of unknowns, and I'm by no means a specialist or a researcher. But if you look at GLP-1s, for example, what do GLP-1s do? It is a hormone that works on your gut and on your stomach and on your brain, basically telling you, hey, you've had enough. You don't have to eat anymore. So when people inject those GLP-1s, because you naturally have them in your body, but when you don't have enough, you have to inject. Just like any other hormone, you don't have enough thyroid hormones, you're going to take a pill. So again, it's the same thing here. So when you inject that GLP-1 agonist, what you're going to feel is that you're going to be fuller quicker, and your gastric emptying will also be delayed. So you're just going to feel fuller longer. And so that's how it works, basically.
And it's really great at quieting the food noise that a lot of people living with obesity face. I know for a lot of my life, it was always, when am I going to eat? Where am I going to eat? How much did I eat? Where can I get some more? And all of that kind of gets quiet.
I've heard you speak before in the past, Sandra, too, and I remember hearing you talk about, how some of those ultra processed foods really hijack the brain's reward system and really like makes moderation nearly impossible. Can you dive into that a little bit more and help us understand that?
Yeah. So when I was in New York last week, the United Nations put together a global obesity forum, and we heard from people all over the world, and they are pointing the finger directly at ultra processed foods. Egypt, the Philippines, Greece, Mexico, they did not mince their words about ultra processed foods, because they are not actually foods. Chemically engineered food-like substances that are made to overwhelm our reward center. And for so many of us, we can become susceptible to that, where it doesn't satiate us. And we are now seeing through the research, it does change the brain and the connections that are formed that looks very similar to the connections formed with addiction. And at the United Nations, there was a specific focus on childhood obesity that is quadrupling in some areas of our world, usually in the more lower economic environments. And not to say in every other environment they are tripling and doubling at a rate that is incredibly alarming, because when we are not labeling food properly, we heard of an excellent initiative from Spain where they are grading their food so that the consumer can make an intelligent decision, because we see it here in Canada. Oh, this cereal is fortified with vitamin C and it has added protein. Well, in Spain, that same cereal will get an F. And that's really important, because as a mom, when I'm choosing a cereal for my daughter, I might be enticed to pick up that protein enriched cereal, not knowing that it would get a grade of F.
Well said. I think that's a great opportunity that, as a society we can take from and learn from. So, I'm glad you could share that. If you were designing a benefits plan with a holistic weight management approach today, how would you in your eyes look at designing that program for our audience?
I think it would need to, of course, be covering two of the three pillars. So it needs to cover pharmacological options, it needs to cover psychology, it also has to cover the two bases of the foundation, which is basically nutrition therapy as well as exercise therapy via sports therapist, kinesiologist, whatever. Bariatric surgery, on the other hand, is usually a medical act, so it cannot be covered by private insurers. But there are things that can. So, for example, someone that actually gets a bariatric surgery done, but then let's say has a lot of saggy skin afterwards, it's very hard for these people to get reimbursement by the public payer, actually, to get it removed. So that's something perhaps in the future that can also be looked at in terms of holistic help for insurance.
Yeah, good point. Possibly for a spending account as an example. So there's options out there that companies could
Yes.
look at. Interesting. Good. Thank
Yes.
you.
Good. So now we're at the point in the episode. I always ask Rob this question as the advisor, and maybe I'll pair up Rob and Sandra for this one. So, Neda, you've just helped us design, what are some key components of coverage to provide. Now let's get to communication and building awareness of this newly designed plan that helps support people. Rob and Sandra, how could an employer best communicate and educate plan members and their families about this coverage?
I think obviously it has to come from the leadership down. I think the education about the fact that it is a chronic illness. Our employees are important to us, that we understand the health of our employees is the health of our organization. And because we believe this is a chronic illness, we are providing this, and this. You put the money where the mouth is. I think is a great way to start.
First of all, I think you're absolutely right. There has to be a champion in every organization when it comes to communication. Employers, you can lean on your benefit consultants. Him or her can absolutely, hopefully, support it, because a lot of people, frankly, don't understand everything that's available to them, especially if they're looking for options in a time of need. And we, as an organization, talk a lot about the three pillars of people's well-being, right? Their financial well-being, their mental well-being, and their physical well-being, and they're all interconnected, right? That three-legged stool is all interconnected, and no matter what we're talking about, if there's a financial impact, maybe somebody won't do it, right? And Sandra, you brought up in a time when, like, we've coming out, the time's been tough for a lot of people from a money management standpoint, and everything's more expensive. And especially the grocery stores, we know that is absolutely more expensive than ever to have healthy living at times. When you're seeing strawberries at like $8 for a little thing of strawberries now, so people are probably making decisions that, could impact them. So having that support, like, all around, and that aware of all the options that their employers providing them, I think is critical. So, yeah, I agree with you completely. And it's constant communication. It's not just like once a year a lunch and learn. Companies got to be strategic and creative now, and there's greater tools than ever before too for companies to provide that greater emphasis on options to provide their staff with everything that's available to them. And I think you're right. Coming back from an earlier, what you said about an ROI, investing in your people, it's an investment in your organization, and that's what people are looking for. Is if they want to stay a long time at an employer. So what's my employer willing to do for me? And it goes a long way.
Yeah, I think the tides have definitely turned. I think when I entered the workforce in the early 90s, I was just grateful to have a job. And my motto was like, I'm going to outwork anybody. And the philosophy was leave your problems at the door. Oh, sorry, your mom's dying? We don't want to hear about that. Oh, you're going through a divorce? Too bad, so sad. When you come to work, you just put on the suit and you perform and you perform. I don't want that for my daughter's generation. And I don't think that's what the 20 somethings are looking for right now. I think they are looking for value based work. How do you care about me as a person? Does my work have purpose? And if you're not going to care for your employees, you're not getting top talent. And then we go back to the bottom line. You're not going to get where you want to go.
One of the benefits of doing the Benefits Alliance podcast is that we're learning some of the best practices around communication. And so when I think about being an employee and hearing from my employer that a message that says, whether you struggle with mental health issues, whether you're going through divorce or you need here's your EAP, whether you have or know someone in your family, ADHD, or whether there's depression happening or heart health and cancer in the workplace and obesity. Like there's something here for everyone. And I think people will hear those specific words for a lot of categories of health and mental health conditions, and just remember that, right? For when the time comes for themselves or their families, that there is something for obesity now. Very, very key to help just build out awareness and not feel targeted is my impression. I don't know if you want to add to that, anyone.
No, I think that's great. And it just probably from an employer standpoint, it could just, if they're listening to our podcast, to show that modernization of benefit programs is so critical, right? Like, benefit plans were invented, what now, like 60 years ago? And it like, tides have changed dramatically. Like, not 60 years, especially in the last like six. So that modernization is more critical than ever about, especially when you got most organizations of 4 or 5 generations in their workforce, regardless of their size. So how do you appease everything? And how do you ensure that the people that need the right support at the right time are aware of it and can get those options?
Awesome. Well, let's do one last question for each of you. I'm going to ask any final advice for employers today. And we can start with Neda.
Yeah, so I think what resonated with me today is that employers have a really powerful role to play. So if they could start by creating inclusive environments from physical spaces to workplace culture, and by physical places, I mean things such as, having a large chair available, having bathrooms with large doors, those are really important things. Providing standing desks or having healthy food options and vending machines. They're very simple things, but at least they can make someone feel better at the end of the day. So, and that's, I guess, the personal side of things. But when we go to the benefit plan type of things, well, my advice would be to not necessarily think about the cost of these drugs, because at the end of the day, whatever they cost, the cost of inaction is much, much bigger, because you end up with cancers, you end up with cardiovascular disease, diabetes, and all these diseases, well, they lead to absenteeism, presenteeism. So there's a cost to not doing anything. And it would be best to cover these drugs. And if you cannot afford to cover them with an unlimited maximum, well, then just put in a maximum. It's obviously not the ideal solution, but it's better than nothing.
Sandra, what's your final advice for employers?
Yes. So right now in Canada, over 40% of our population is living with overweight or obesity. So that means that every employer, whether you're living with it, knows someone that you love and you've witnessed them really struggle in areas of career and relationships and health and finances. So my hope is in listening to this podcast that you can look at them through the lens of compassion, newfound understanding that obesity is so much more than willpower, that it is a brain-based chronic illness that deserves the dignity of treatment.
Well, this has been great. Netta, Sandra, you've been very enlightening and provided our audience with a lot of great information and takeaways so they can think about, especially as we head towards the end of the year and they're doing their planning for 2026, what different things they can do to accommodate and not only accommodate but bring forward some forward-thinking benefit plan structuring more than anything, and how they can provide additional communication, knowing there's a lot of options out there. So thank you very much for joining us today. We really appreciate it.
Thank you for having us.
Thank you.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.